Well, we're now joined by the Auditor General of Canada, Karen Hogan. Ms. Hogan, good to see you again.
Hi.
So you have released two reports today, and I do want to begin with the benefits paid out to Canadians during the height of the pandemic. Now you credit these payments for preventing a rise in poverty, helping Canadians with financial challenges, not to mention the economy. But billions of dollars went to people who did not qualify. Just how much money are we talking about? How did that even happen?
So you're right, you're referring to our audit on the COVID-19 benefits. And in that audit, we looked at least 6 COVID support programs to individuals and businesses. And we identified that because of the government's early decision to limit prepayment controls and rely on attestations, they even identified that it would result in payments going to ineligible individuals. And what we found is that $4.6 billion went to individuals who were ineligible to receive those payments. And we also estimated that at least $27.4 billion require further investigation that were paid to either individuals or businesses through the COVID-19 support program.
Okay, so more investigation, but what do you think that investigation would actually find?
So the first step really here is to identify whether or not individuals and businesses were in fact ineligible. There was no information or limited information gathered on application from individuals and very little information gathered from businesses. And the government needs to do a more comprehensive and rigorous post-payment verification work, follow up with those people and businesses to confirm if they meet the criteria. And once you've identified the payments that are ineligible, then you can make the decision about the next steps and recovery.
Now, what's interesting about that is in your report, you note the fact that there is a window to recover some of that money, but you say, that the window is quickly closing?
Absolutely. The window is quickly closing. Existing legislation for individuals gives the government about 36 months to identify whether or not a payment was made to someone who shouldn't have received it. Now, that time period is extended if there was some fraud or intention to deceive. When it comes to businesses, for the most part, that period of time to identify ineligible payments is somewhere between 36 and 48 months. And so it is time for the government to speed up its post-payment work in order to be able to get those notifications out to individuals and businesses.
Okay, businesses aside, I'm actually thinking about individuals right now, because does it actually make sense to go after these individuals? It would cost money to do that. And if payments went to low-income people or families, who would the government really be hurting?
So it really isn't my decision to decide on policy and legislative approaches. My expectations are grounded in 2 things. Following my first audit in 2021, the Canada Revenue Agency and Employment and Social Development Canada committed to comprehensive post-payment verification work. And existing legislation here in Canada states that every taxpayer, whether they be an individual or business, should be treated fairly. And when amounts received they're not entitled to, those should be returned. If the government, however, wants to take a different approach, one where they might forgive repayment or take an empathetic approach to collections, then that's their decision to be made. But I recommend that they be clear and transparent with all Canadians so that everyone knows what to expect.
Mm-hmm. Now, your other report today, it deals with the procurement and the distribution of COVID-19 vaccines. Now, you give the government, a good review for acquiring and distributing the vaccines in a timely manner, but you also say that millions of doses were wasted. Just how many are we talking about here?
So in that audit, we looked at whether the Public Health Agency of Canada, Health Canada, and Public Service and Procurement Canada were able to secure sufficient doses for all Canadians who wanted to be vaccinated. And what we found is they did a good job responding to the uncertainty and ever-evolving nature of the pandemic. Early on in 2020, the government signed 7 advance purchase agreements because of the uncertainty at that time, and that resulted in there being a surplus of doses that have not been able to be used or donated. Throughout our audit period, we identified about a little over 13 million doses have expired so far on the shelves, and some more are set to expire before the end of the year.
Now, avoidable is that, though? Because at the beginning, the government was casting a wide net, really not knowing, as you alluded to, which company would come out with a successful vaccine first. I'm wondering if in that time period, whether or not waste is just, a cost of doing business at the time. And when you talk about vaccines right now, the government is supplying it. It does mean to say Canadians are picking up on those doses, though.
Yeah, so the decision back in 2020, it's easy to sit today and look back and say, gee, we should have made a different choice as a country. But if you put yourself back in 2020 and look at the global demand, the race to get a vaccine, no one knew which vaccine company would be the first to have a viable vaccine out there. Would they be approved for use in Canada? And so all that uncertainty meant that the government signed additional contracts. I would say that their approach was a prudent one in order to ensure that every Canadian who wanted access to a vaccine was able to get access. We don't have Canadian manufacturing, so add that on, and it adds to some of that uncertainty. What could have been done better throughout the pandemic, however, is managing the supply and the needs and the logistics, and that's where we made a recommendation around the IT system that was developed called Vaccine Connect. In order to manage it, the government didn't use all the functionalities, and that really would have hopefully helped limit some of the wastage, and if it's fully utilized now, may help do that as we buy more bivalents across the country.
Mm-hmm. Now, as you noted in your own news conference, healthcare is delivered both provincially and federally. So even if you make this recommendation to Ottawa, what about the provinces in sharing that kind of information?
I think that's an issue that my office has raised for almost a quarter of a century now. I would go back to our first audit in 1999, where we talked about the need to figure out the sharing of health surveillance information across the country. Provinces, territories, and the federal government have not ironed out what to share and when to share information during emergencies. I don't know how many other public health crisis that we need before the country sorts out this issue. It's one that would not only improve the healthcare system, but improve responses to health emergencies like we've lived through with H1N1, SARS, and now COVID-19.
Karen Hogan, really appreciate your time today. Thank you for that.
It's my pleasure. Thank you.